Smoke from the record-setting Canadian wildfires is again making the air hazardous to breathe this weekend across the northern plains and upper Midwest. Dealing with this summer smoke is a new experience for many outside the western United States, where it's all too common. And as the smoke triggers breathing problems for many, it also highlights the fact that more than 5 million Americans don't have easy access to a respiratory specialist.
Look at the cloud.
For Walt and Penny Copeland, the small town of Hayden, Colorado has been home for 5 decades. Set high in the Rocky Mountains, they're that much closer to the deep blue skies and puffy white clouds.
Maybe take a bunch of deep breaths. Yeah,
don't cheat on your oxygen test.
I didn't.
3 years ago, they were comfortably settled into retired life when Walt began having breathing problems.
I was having a checkup after my heart valve. Once a year, I'd go for a checkup. And they found a little spot on my left lung that was kind of cloudy.
127.
He was diagnosed with pneumonitis, inflammation of the lung tissue, also called farmer's lung.
There's hundreds of different types of farmer's lung, which mold, sawdust. I grew up with parents that smoked, and I worked out at the coal mine, and I hauled fuel and stuff like that, but no scar, nothing showed up.
Retired from long-haul trucking, Walt thought he was done with long, regularly scheduled drives. But from his home in Hayden, going to a pulmonologist every 3 months for checkups meant a round-trip drive of 8 to 10 hours.
10 hours for a 15-minute visit. That's why we always waited for him to come up here. Let him do the driving.
You've done enough driving over the years.
Yeah, I have.
Instead, the pulmonologist comes to him.
No sign of a flare-up?
Not yet, not that I've seen.
Once a month, Dr. James Hoyt of UC Health, a not-for-profit regional health system, makes the trek to a medical center in Steamboat Springs from his office in Fort Collins. During each visit to the ski resort town, he has 9 hours of patient appointments over 2 consecutive days. 180 miles each way with a 1,300-foot elevation change. Dr. Hoyt's been making this monthly trip for the last decade.
It's about 4,000 miles a year, so 40,000 miles, 50,000 miles. And I've gotten one new windshield, one new bumper, a whole new front end when I hit a deer, but I've only, for weather, not made it once.
For hundreds of Dr. Hoyt's patients across northwestern Colorado and southern Wyoming, it's a life changer. Walt Copeland gets to his appointments in just a 30-minute drive, usually combining the trip with other errands.
Square toe.
Many parts of the country, especially the rural West, have limited access to pulmonologists. According to telehealth and prescription discount provider GoodRx, more than 5 million Americans are more than a 1-hour drive from a respiratory specialist, living in pulmonology deserts. Respiratory specialists have been in high demand in recent years as an aging population has a higher risk of COPD. Then came COVID-19 and the damage it can do to the lungs of those infected with the virus. Burnout from the pandemic has led to pulmonologists retiring early or changing specialties.
There were 2 really hard times. And the first time was when it first came, and 14 or so of us all got in a room and looked at each other and wondered who's going in first, because there were no vaccines. There was PPE that we didn't really know for sure if it worked or not. The second really hard time in COVID was when our healthcare teams were exhausted from 18 months or so of grinding, and there were more than enough vaccines for everyone. And patient after patient after patient we took care of was unvaccinated by choice.
Climate change plays a role too, helping make wildfires bigger and more intense and the air more hazardous to breathe. Last summer, this beautiful vista was obscured by smoke from wildfires in California, Oregon, and Washington state. In fact, wildfires can lead to air quality alerts hundreds of miles downwind. And as the fine particulate matter in that smoke drifts across the country, it can leave a trail of people headed to doctors' offices, urgent care clinics, and emergency rooms with respiratory problems. Walt Copeland's wife, Penny, has asthma.
Smoke is one of the things that I am allergic to. So when the valley would fill with smoke, I basically had to stay indoors with the windows closed, and it would make it difficult to breathe at night. When you don't get enough air, you don't function. You just basically have to sit on the couch and that's it.
Over the last few decades, the West has been seeing, this just gradual uptick in the number of fires, how large they are and how severe they are.
Jennifer Stowell is a researcher at Boston University's School of Public Health. She says wildfire smoke from Canada and the western United States will continue to affect parts of the country unaccustomed to it. What's the effect on health, on public health?
A lot of that depends on, what is burned and how far it gets. It affects people who already have sensitivities. And generally, the big one is respiratory that we would expect. Say, for instance, if I had asthma and I had, a significant exposure to wildfire smoke, the likelihood that I would show up at an ER because of my asthma is probably about 8% more likely on a day that I'm exposed to smoke than on a day when I'm not exposed.
And that, Stowell says, means more hospital visits.
The important thing for people to know is to remain indoors if you can, especially if you look at the air quality colors. If it's worse than yellow, you want to stay indoors. If you have underlying conditions like asthma or COPD, you want to stay indoors as soon as it gets out of that green area. And if you have to go outside, definitely wear a mask.
Penny Copeland doesn't need a researcher to tell her what the shortage of respiratory specialists means. Every time her asthma gets bad, she feels it.
Usually when you have a flare, it's good to be seen by a pulmonologist so they can kind of help you through that and give you more treatment. But when we have a pulmonologist only here once a month, your asthma flares usually don't come along when he's here.
And the asthma doesn't pay attention to Dr. Hoyt's schedule.
No, it does not.
Right. At UC Health's Medical Center in Steamboat Springs, Clinic Operations Director Ryan Larson recognizes the need. He's begun the challenging task of hiring a full-time staff pulmonologist.
We started recruiting in January 2023, and we're looking to have a full-time provider starting next summer, July 2024.
And how hard is that?
So far, it's been pretty hard. We've had quite a few candidates come through, but no one's been a right fit for the community.
I've walked out of the office, sat in my car and called him for an appointment. And, we don't have his appointment schedule ready yet. So I said, okay, I'll call back later. Or then when I do, they say it's filled up.
And as Dr. Hoyt's limited appointments become harder to get, Walt and Penny Copeland hold their breath, waiting for the right candidate to fill the gap.